Good morning. Okay, so this morning we are going to talk about nutrition. And I have a few things that I want to just talk about, just to put out there for a review. We don't necessarily have a nutrition course, so you're going to learn about different aspects of nutrition all throughout the PN program. So first, let's talk about some vitamins and the different vitamins that are in this chapter that are specific to what you need to know are B12, which is also called cyanocobalamin. Yes, I know that's a mouthful, but cyanocobalamin is vitamin B12. Vitamin C, the other name for that, is also going to be ascorbic acid. And then you have thiamine. Thiamine is vitamin B1. And you have iron. Iron is on the periodic table in a chemistry class as Fe, and another name for that is also thiazole. Then you have vitamin D. Vitamin D comes in different strengths and different unit doses. We have D2, we have D3, all different types, but primarily what we see a lot in long-term care settings is vitamin D3, which is the cholecalciferol. So cholecalciferol is basically vitamin D, and it has cal in it, if you notice, because one of the main functions of vitamin D is to help the body absorb calcium. Where do we get vitamin D? Well, we get all of these vitamins in different foods, and that's what I would like to talk about next is some different types of ingredients and nutritional vitamins and pieces in different foods, as well as what we are going to talk about different types of diets. So, the first thing that I want to talk about is let's look at carbohydrates. So carbohydrates, if you don't already know this, break down into sugars. Different carbohydrates, things like whole fruits, there are potatoes, corn, sugary sweets, all those things we like to eat, desserts, breads, soda, sugary soda, Pepsi, Coke, all of that has a significant amount of carbohydrates on it. So when your patient is ordered for a low carbohydrate or a high carbohydrate diet, it's essential to know what kinds of foods that you can teach them that they would be eating. Then we have proteins. When you think of protein, what do you think of? You think of eggs, you think of chicken, you think of lean beef, you think of pork, you think of tuna. What else is besides meats has a lot of protein? Low-fat yogurt. Low-fat yogurt has a lot of protein. I don't know if I'm saying this right, but tofu also has a lot of protein, as well as peanut butter. Peanut butter also has a lot of protein. So protein and carbs are essential for your body. There's two main functions that protein and carbs will serve in the metabolic system. Carbs primarily provide energy. So again, depending upon what types of carbs you're eating, whether that's a sugary sweet or a potato, it can take your body longer to metabolize it, and the energy level will be different. Proteins, what they do significantly is they build tissue. So that's why when you're taking care of somebody who has an injury, they tell them that they need to have a high protein diet because they build tissue, which also is the same thing as promoting healing. So proteins promote healing, they build tissue, carbohydrates provide energy. All right, something else that's in our diet that we need to focus on is fiber. Fiber is going to be an important thing in our diet to help with digestion. And what is some things that you can think of that is high in fiber? Yes, beans. Beans is high in fiber, especially black beans. Other things that are high in fiber are things like seeds, specifically like flax seeds or chia seeds. So sometimes people will add in flax seed or chia seed to their recipes just to increase a little bit of fiber to help increase that in their diet. Lentils. Something that you may not be aware of is raspberries. Raspberries are very high in fiber, and green peas. Green peas are very high in fiber. So those are some of the things that you want to make a note of. So if you're thinking about what you can teach your patient to increase fiber in their diet. So let's talk a little bit about sodium, because those patients that possibly have heart disease or hypertension or even kidney disease may be on a low sodium diet. So it's important to know what foods are high in sodium. So foods that are high in sodium, those are all of the things that we like, just like carbs. So unfortunately, it's difficult for those patients to try to reduce sodium, but let's just go over a few. So some of the things, obviously bacon, sausage, prepared meals or frozen meals that you buy in the freezer section of the refrigerator, canned goods, canned soup, tomato-based product like spaghetti sauce or pizza sauce. All of those things are very high in sodium content, and those are the things that you would want to limit if you were on a low sodium diet. Okay, so I wanted to talk about a few of those vitamins. I also wanted to talk about the carbs, the protein, the fiber, and the sodium. Another thing that I just want to talk about is some different types of diet. In your book, it talks about the difference between a clear liquid diet and a full liquid diet versus a regular diet. So when people are on a clear liquid diet, it is either for a pre-procedure or for a post-operative procedure. A clear liquid diet consists of anything that you can see through except for black coffee. Black coffee is also considered a clear liquid. Some other things, obviously, would be popsicles. It would be Jell-O. It would be soup broth, like chicken broth or beef broth. Anything that you can see through. Pretty simple. Full liquids, again, you can't see through them. You can have clear liquids on a full liquid diet. So that's what I meant to say. Okay, full liquids would consist of things like pudding. It would consist of ice cream. It would consist of even anything that has like a creamy consistency, like a cream-based soup that does not have chunks in it, such as tomato soup. Okay. Typically, the reason this is important is because when patients are NPO for a procedure, they will always be started on clear liquids in the event that we are concerned that there might be some emesis, because we don't want to disrupt the GI tract and upset the apple cart, I guess, if you could say, upset the apple cart too much. We don't want to rumble the stomach too much, and especially if there's an incision involved. So we have clear liquids, we have full liquids, and then we will typically advance them to a regular diet. And their regular diet is going to be what's regular for them. So for you and me, we're on a regular diet. Most of us are, as long as we are healthy and don't suffer any disease of the cardiac system or the renal system or the liver or whatnot. Other kinds of diets that you'll see are either a pureed diet or a mechanical soft diet. So think about foods that could possibly be pureed. Pureed means that basically we're going to put the food into a blender and we're going to mash it up so that it doesn't have any chunks in it. So you can puree just about anything. You can puree peas, you can puree corn, you can puree chicken, whatever it may be. And that's going to be for patients that have difficulty swallowing, or what we call dysphagia. Then we have a mechanical soft. Mechanical soft diet is, again, can be for people who have dysphagia, but again, it can be for people who still have the ability to chew, but maybe have some difficulty. For example, as we get older, sometimes we will lose the our bones will, for lack of a better word, shrink up. Some people have problems with their dentures. Their dentures maybe fit poorly, or they cause irritation to the gum line, and because of that, they don't want to keep them in, but they still want to be able to chew. So mechanical soft would be maybe mashed potatoes that have a few little lumps in them. That could be mechanical soft. So you just want to think of things that don't require a lot of chewing and who would be on that. And then another type of a diet would be a high protein diet. A high protein diet is also a diet that would be high in the foods that we talked about that have a lot of protein in it. So based on a dietary chart for how much protein is typically required in a day, they would want to increase that. Normally, a person needs about 1,500 to 2,000 milliliters of water in a day, and we drink about 1,500 to 2,000 milliliters of water to keep our immune system healthy, to keep things flowing, to keep the digestive tract working well. So if I'm going to increase anything in my diet, if I'm going to increase protein, if I'm going to increase carbohydrates, if I'm going to increase fluid, typically they will at least do 1.5 to 2 times that. So when I say 1.5 to 2 times, if a normal water consumption is 1,500 to 2,000 for a normal adult, then when they say that they want to increase fluids, we would say possibly 3,000 to 4,000 would be increase fluid, and that's in milliliters, 3,000 to 4,000 milliliters per day. Okay. So let's talk about some different types of diets. Sometimes your patient might be ordered for a cardiac diet. Cardiac diet, what do you think would be on a cardiac diet? Typically, they're concerned about fats. So fats are the things that are going to clog up the arteries, cause what we call arteriosclerosis and atherosclerosis by a buildup of cholesterol in the lining of the vessels of the wall, including the coronary arteries, which then will lead to what we call CAD, or coronary artery disease, or HF, heart failure, if it gets to that point. So a cardiac diet is typically, they like to have lean meats, plant-based foods, no animal meats, no beef or steak or lamb or things like that. They would prefer that you have lean fish, poultry, and healthy fruits and healthy vegetables, and whole grains instead of flour-based breads. They would prefer whole grains. Okay. Important because if somebody comes in and they suddenly are diagnosed with heart disease or some type of a blockage and they have to put a stent in to prevent further damage, you want to educate them on what a cardiac diet would be. Another type of a diet that's common is a renal diet. A renal diet, typically we will tell patients to decrease their sodium, just like we would for hypertension. Decrease protein, because the kidneys have a hard time filtering those protein molecules. Decrease phosphorus, and sometimes we might even limit fluids, because if patients are in advanced stages of renal disease, it might be difficult for them to manage even the normal daily requirement of 1,500 to 2,000 milliliters of fluid. Another type of diet that you may see is called the DASH diet. DASH stands for Diet Aimed to Stop Hypertension. So we know that sodium causes hypertension because it holds on to water. There's an old saying that says where sodium goes, so does water. So if a patient or a person is eating a lot of foods that are high in sodium, they're going to hold on to water. If you have diseased vessels in which you have a lot of buildup, whether that be from a history of diabetes or a poor diet most of your life where you ate a lot of fried foods that had a lot of cholesterol and things like that in it, then you would have hypertension. And the hypertension, again, could be related to that, or it could simply just be something that you're just blessed with genetically because your mother had it, your father had it, and now you have it, even though you follow all of the rules of healthy nutrition. Okay. Let's see. There's some other things that I did want to talk about as far as feeding, but I think I'm going to save that for the next mini brief little review. But specifically eating disorders and things like that. So I'll talk to you on the next thing with that. However, let's also consider when you're studying your different types of diets, not only if a person has an illness like renal disease or diabetes or anything like that, what kind of a diet they would be on, but what about their culture? You have to take that into consideration because different cultures, different cultural backgrounds will eat different types of food. For example, if you are Hispanic or Mexican, they eat a lot of spicy foods. Asians eat a lot of carbohydrates. They eat a lot of rice. They eat a lot of pastas and noodles and things like that. Muslims, again, they have restrictions on the different types of proteins and things like that that they can eat. So take all of that into effect, and that's one of the things they'll look at when they're trying to figure out, what can I teach this patient that they can eat? Because if they do have cultural preferences, you can't take away all of their desires and all of their things that they've been taught to eat based on their culture. That's it for now.